Question 1. A 34-year-old postoperative patient suddenly develops stridor, hypotension, and facial swelling. What is the nurse's immediate priority? A. Notify the rapid response team. B. Administer IV diphenhydramine. C. Inject intramuscular epinephrine. D. Position the patient in high Fowlers. Answer. C. Inject intramuscular epinephrine. Rationale. IM epinephrine is the first-line treatment in anaphylaxis due to its rapid reversal of airway edema, hypotension, and bronchospasm. Notifying the team, A, is important but not the first step. Diphenhydramine, B, is a secondary medication. High Fowlers, D, may worsen hypotension in anaphylactic shock. Question 2. A patient receiving IV antibiotics reports a funny feeling in the throat and dizziness. Which action by the nurse demonstrates the most effective clinical judgment? A. Document the reaction and slow the IV rate. B. Call the physician for clarification. C. Discontinue the antibiotic immediately and assess vitals. D. Administer oxygen via nasal cannula. Answer. C. Discontinue the antibiotic immediately and assess vitals. Rationale. Early signs of anaphylaxis require immediate cessation of the offending agent and vital signs monitoring. Delaying action, ABD, risks progression to life-threatening symptoms. Question 3. During an anaphylactic emergency, the nurse is delegating tasks. Which assignment is most appropriate for the unlicensed assistive personnel UAP? A. Monitor blood pressure every 2 minutes. B. Prepare epinephrine for administration. C. Retrieve the code cart and stay with the patient. D. Assess lung sounds for wheezing. Answer. C. Retrieve the code cart and stay with the patient. Rationale. UAPs may assist with non-clinical but critical supportive tasks, like bringing equipment and comforting the patient. A, B, and D require clinical training. Question 4. A nurse administers IM epinephrine to a child with anaphylaxis. What adverse effect must be closely monitored next? A. Hyperkalemia. B. Tachyarrhythmia. C. Bradycardia. D. Seizures. Answer. B. Tachyarrhythmia. Rationale. Epinephrine stimulates beta receptors, increasing heart rate and risk for dangerous arrhythmias. Monitoring is essential post-administration. Question 5. A patient with a known allergy to latex is scheduled for surgery. What is the most appropriate nursing intervention before the procedure? A. Notify the surgeon and schedule as last case. B. Label the chart and equipment as latex-free and ensure all supplies used are latex-free. C. Administer a prophylactic dose of diphenhydramine. D. Instruct the patient to bring their own supplies. Answer. B. Label the chart and equipment as latex-free and ensure all supplies used are latex-free. Rationale. Proactive labeling and environmental control are the best strategies to prevent exposure. A is outdated. Surgery should be scheduled first. C is insufficient. D is inappropriate. Question 6. A nurse witnesses a patient collapse with suspected anaphylaxis in a public area. What is the nurse's legal and ethical obligation? A. Wait for EMS due to lack of consent. B. Begin CPR if pulseless and administer epinephrine if available. C. Seek permission from a family member. D. Call hospital security before intervening. Answer. B. Begin CPR if pulseless and administer epinephrine if available. Rationale. Under Good Samaritan laws, nurses must act promptly in emergencies using available resources. A, C, and D delay life-saving care. Question 7. A patient who received a contrast dye begins vomiting and develops wheezing and urticaria. What is the nurse's most important next action? A. Elevate the lower extremities. B. Notify radiology staff. C. Administer IM epinephrine immediately. D. Apply a cool compress. Answer: C. Administer IM epinephrine immediately. Rationale: rapid response with epinephrine is the priority. The patient is progressing toward severe anaphylaxis. A, B, and D are secondary steps. Question 8. Following treatment for anaphylaxis, the patient is stabilized. What instruction is most critical prior to discharge? A. Avoid all shellfish. B. Carry an epinephrine autoinjector at all times. C. Increase fluid intake. D. Follow up with a primary care provider in 1 week. Answer: B. Carry an epinephrine autoinjector at all times. Rationale: future episodes can be fatal without access to epinephrine. A is important only if shellfish was the allergen. C and D are supportive but not critical. Question 9. A nurse suspects early anaphylaxis in a patient receiving a new IV medication. Which assessment finding confirms this suspicion? A. Heart rate 82 bpm, BP 122/78. B. Warm, flushed skin with urticaria. C. Urinary retention. D. Slurred speech. Answer: B. Warm, flushed skin with urticaria. Rationale: urticaria and flushing are early warning signs. A is normal vitals. C and D are not classic features of anaphylaxis. Question 10. A student nurse accidentally administers penicillin to a patient with a documented allergy. The patient begins wheezing. What should the supervising nurse do first? A. Contact the healthcare provider. B. Administer diphenhydramine. C. Administer epinephrine and maintain airway. D. Complete an incident report. Answer: C. Administer epinephrine and maintain airway. Rationale: immediate action saves life. Delay for contacting providers or documentation is unsafe in emergencies. Question 11. A nurse prepares to administer epinephrine for anaphylaxis, but cannot find the patient's documented weight. What is the best action? A. Wait to obtain accurate weight. B. Administer 0.3 milligrams IM, standard adult dose. C. Give half of the standard dose to prevent overdose. D. Notify the pharmacist for a recommendation. Answer: B. Administer 0.3 milligrams IM, standard adult dose. Rationale: in emergencies, standardized adult dosing, 0.3 milligrams, should be used to avoid delay. Time spent on A, C, D risks patient death. Question 12. A patient treated for anaphylaxis becomes confused, pale, and hypotensive. Which action should the nurse take next? A. Administer naloxone. B. Lower the head of the bed. C. Initiate a second dose of epinephrine. D. Call a psychiatric consult. Answer: C. Initiate a second dose of epinephrine. Rationale: refractory anaphylaxis may require repeat doses every 5 to 15 minutes. A and D are inappropriate. B may worsen airway obstruction. Question 13. Which finding indicates the most severe progression of anaphylaxis in a patient? A. Tongue swelling. B. Anxiety and tachycardia. C. Hives over trunk. D. Pruritus and dry mouth. Answer: A. Tongue swelling. Rationale: tongue swelling threatens airway patency and signals severe airway involvement. Others are early symptoms. Question 14. After stabilizing a patient with anaphylaxis, which laboratory value should the nurse monitor closely? A. Serum potassium. B. Serum tryptase. C. Hemoglobin. D. BUN. Answer: B. Serum tryptase. Rationale: tryptase is elevated in anaphylaxis and supports diagnosis. A, C, and D are unrelated. Question 15. A pediatric patient with peanut allergy is unconscious after accidental exposure. What is the most critical nursing action? A. Call family for consent. B. Start IV fluids. C. Administer IM epinephrine immediately. D. Apply ice to mouth. Answer: C. Administer IM epinephrine immediately. Rationale: immediate epinephrine is life-saving. Consent is implied in emergencies. IV fluids come later. Ice is ineffective. Question 16. During a simulation, a nurse fails to recognize anaphylaxis and delays epinephrine. What concept of clinical judgment is most compromised? A. Reflecting. B. Noticing. C. Interpreting. D. Responding. Answer: B. Noticing. Rationale: failure to detect early signs means the nurse didn't notice the clinical cues, a key component of Tanner's clinical judgment model. Question 17. Which action best demonstrates interprofessional collaboration during an anaphylactic emergency? A. The nurse documents all actions afterward. B. The nurse asks the pharmacist for epinephrine dilution guidance. C. The nurse independently manages airway and drugs. D. The nurse instructs UAP to manage medication supply. Answer: B. The nurse asks the pharmacist for epinephrine dilution guidance. Rationale: timely collaboration with specialists improves safety and precision. A. C. D. Show protein coordination. Question 18. A nurse in triage identifies lip swelling and hoarseness in a patient with a nut allergy. What should be done before room placement? A. Ask the patient to complete forms. B. Take vitals and move them last. C. Give epinephrine immediately and notify the emergency team. D. Offer cool liquids. Answer: C. Give epinephrine immediately and notify the emergency team. Rationale: swelling and hoarseness indicate airway compromise. Delay for administrative tasks is dangerous. Question 19. Which symptom is least likely to appear in the early phase of anaphylaxis? A. Itching and flushing. B. Wheezing and dyspnea. C. Confusion and unresponsiveness. D. Lip tingling and hives. Answer: C. Confusion and unresponsiveness. Rationale: these are late signs of shock or hypoxia. Early signs include A, B, D. Question 20. Which patient teaching is most important after discharge for anaphylaxis? A. Avoid perfume and all scented products. B. Keep antihistamines in your car. C. Wear a medical alert bracelet and review how to use the auto-injector. D. Get allergy shots regularly. Answer: C. Wear a medical alert bracelet and review how to use the auto-injector. Rationale: medical identification and readiness to self-administer epinephrine are essential for future safety. Question 21. A patient begins experiencing chest tightness and hypotension following a bee sting. What is the best initial nursing action? A. Apply a tourniquet above the sting site. B. Administer 100% oxygen via non-rebreather mask. C. Inject subcutaneous epinephrine. D. Begin chest compressions. Answer: B. Administer 100% oxygen via non-rebreather mask. Rationale: high concentration oxygen supports oxygenation in hypoxic or hypotensive states. IM, not subcutaneous, epinephrine is preferred. A tourniquet is not recommended. D is only for cardiac arrest. Question 22. After IM epinephrine, a patient develops chest pain and ECG changes. What is the most critical next step? A. Reassure the patient and monitor closely. B. Administer aspirin. C. Notify the provider for possible myocardial ischemia. D. Repeat epinephrine in 5 minutes. Answer: C. Notify the provider for possible myocardial ischemia. Rationale: epinephrine can trigger cardiac complications. Provider must be notified. Aspirin isn't priority unless MI is confirmed. Monitoring without escalation is inappropriate. Question 23. A patient with asthma reports throat tightness after starting new medication. What assessment should the nurse prioritize? A. Peak flow measurement. B. Capillary refill. C. Airway patency and stridor. D. Oxygen saturation. Answer: C. Airway patency and stridor. Rationale: stridor and airway compromise are life-threatening. Other assessments follow once the airway is assessed. Question 24. A nurse administers epinephrine into a patient's IV line instead of IM. What is the first priority action? A. Document the error. B. Rapidly flush the line. C. Monitor ECG and vital signs continuously. D. Notify risk management. Answer: C. Monitor ECG and vital signs continuously. Rationale: IV epinephrine can cause life-threatening arrhythmias. Continuous monitoring must occur immediately. Other steps follow. Question 25. A nurse receives an order for oral diphenhydramine for a patient in early anaphylaxis. What is the appropriate response? A. Administer as ordered. B. Hold the dose and call for epinephrine. C. Notify pharmacy for IV diphenhydramine instead. D. Request an antihistamine alternative. Answer: B. Hold the dose and call for epinephrine. Rationale: diphenhydramine is supportive but not a first-line treatment. Epinephrine is needed immediately. Question 26. A patient with suspected anaphylaxis has an airway obstruction and no palpable pulse. What is the nurse's next immediate action? A. Begin CPR and administer epinephrine IM. B. Prepare for intubation. C. Suction the airway and assess breath sounds. D. Notify the provider and document the arrest. Answer: A. Begin CPR and administer epinephrine IM. Rationale: cardiac arrest from anaphylaxis requires CPR and immediate epinephrine to reverse the reaction. Question 27. Which patient scenario requires the most urgent administration of epinephrine? A. Wheezing and pruritus after starting antibiotics. B. Hives and flushing following morphine. C. Stridor and hypotension after shellfish ingestion. D. Nausea and abdominal cramping after peanut exposure. Answer: C. Stridor and hypotension after shellfish ingestion. Rationale: airway compromise and hypotension signal severe anaphylaxis, requiring urgent epinephrine. Other cases are milder. Question 28. What is the rationale behind administering epinephrine IM instead of 4 in most anaphylaxis cases? A. IM route prevents cardiac overload. B. 4 is not absorbed quickly enough. C. IM is safer and causes fewer arrhythmias. D. 4 causes slower symptom resolution. Answer: C. IM is safer and causes fewer arrhythmias. Rationale: IM is preferred for safety and is effective. 4 carries higher risk for arrhythmias and is reserved for cardiac arrest. Question 29. Which patient statement post-anaphylaxis indicates the need for further education? A. I should wear a medical ID bracelet. B. I'll use my epinephrine auto-injector immediately if symptoms return. C. I'll wait 10 minutes to see if symptoms get worse before using epinephrine. D. I should carry my auto-injector everywhere I go. Answer: C. I'll wait 10 minutes to see if symptoms get worse before using epinephrine. Rationale: epinephrine should be used immediately at symptom onset. Delay can result in worsening reaction or death. Question 30. During a code, a nurse draws up epinephrine from a multi-dose vial. What must be done to ensure safe administration? A. Verify dilution and route with another nurse. B. Administer directly via IV push. C. Calculate dose using mg per kg. D. Call pharmacy for verification. Answer: A. Verify dilution and route with another nurse. Rationale: due to high-risk nature of epinephrine, double-checking with another nurse prevents errors. Question 31. A patient with no allergy history develops rash and dizziness 5 minutes after receiving IV vancomycin. What is the best interpretation? A. This is a normal side effect. B. Likely an early sign of anaphylaxis requiring epinephrine. C. Red man syndrome requiring epinephrine. D. A vasovagal reaction. Answer: B. Likely an early sign of anaphylaxis requiring epinephrine. Rationale: sudden symptoms during IV infusion are concerning for anaphylaxis unless clearly red man syndrome, which lacks hypotension. Question 32. Which action best reflects the nurse's role in preventing future anaphylactic reactions? A. Avoiding administration of all antibiotics. B. Encouraging the use of herbal alternatives. C. Meticulously documenting allergies and previous reactions. D. Giving diphenhydramine with all new medications. Answer: C. Meticulously documenting allergies and previous reactions. Rationale: proper allergy documentation and communication is a key safety measure to prevent repeat exposure. Question 33. A patient with anaphylaxis has received epinephrine but now presents with wheezing and restlessness. What is the next best step? A. Administer albuterol via nebulizer. B. Give another dose of epinephrine. C. Begin chest compressions. D. Call the respiratory therapist. Answer: A. Administer albuterol via nebulizer. Rationale: albuterol helps relieve bronchospasm post-epinephrine. Second epinephrine dose is reserved for persistent shock or airway symptoms. Question 34. What legal risk is most significant if a nurse fails to respond to early signs of anaphylaxis? A. Battery. B. Malpractice. C. Abandonment. D. Fraud. Answer: B. Malpractice. Rationale: failure to act according to standards of care that result in patient harm constitutes malpractice. Question 35. A patient with anaphylaxis has a known cardiac history. What precaution should the nurse consider before administering epinephrine? A. Delay administration and call the cardiologist. B. Use lower dose and monitor closely. C. Use oral antihistamines instead. D. Avoid epinephrine entirely. Answer: B. Use lower dose and monitor closely. Rationale: cardiac patients are at higher risk, but epinephrine is still the life-saving drug of choice, adjusted and monitored. Question 36. A nurse caring for a patient post-anaphylaxis prepares discharge teaching. Which information is essential to prevent a repeat episode? A. Instructions to monitor for side effects of steroids. B. Discussing how to identify early symptoms of reaction. C. Explanation of the immune mechanism behind anaphylaxis. D. Information on general dietary changes. Answer: B. Discussing how to identify early symptoms of reaction. Rationale: patient empowerment through early symptom recognition is critical to prompt treatment. Question 37. During mass vaccination, a patient collapses showing signs of anaphylaxis. What equipment must be readily available? A. AED and blood pressure cuff. B. Oxygen, suction, and epinephrine autoinjector. C. Glucometer and antipyretics. D. IV pump and central line kit. Answer: B. Oxygen, suction, and epinephrine autoinjector. Rationale: immediate airway and medication support is essential for managing vaccine-related anaphylaxis. Question 38. A patient who received epinephrine begins to complain of pounding headache and palpitations. What is the best response by the nurse? A. Reassure the patient this is a harmless side effect. B. Notify the provider and assess ECG. C. Stop all medications immediately. D. Elevate the legs to improve perfusion. Answer: B. Notify the provider and assess ECG. Rationale: these may indicate hypertensive crisis or arrhythmia post-epinephrine and need prompt evaluation. Question 39. A newly hired nurse hesitates to administer epinephrine in a suspected anaphylactic event. What is the preceptor's most effective intervention? A. Administer the drug on their behalf. B. Reassign the patient. C. Immediately guide the nurse through safe administration. D. Report the nurse to the supervisor. Answer: C. Immediately guide the nurse through safe administration. Rationale: teaching in real time enhances competence and patient safety. Reassigning or reporting is not productive in emergency. Question 40. What is the best documentation statement following an anaphylactic event? A. Epinephrine given. Reaction resolved. B. Patient allergic to unknown agent. C. Administered 0.3 milligrams epinephrine IM to left thigh at 13:02. Patient airway improved within 1 minute. D. Patient stable. Monitoring continues. Answer: C. Administered 0.3 milligrams epinephrine IM to left thigh at 13:02. Patient airway improved within 1 minute. Rationale: specific time-stamped and outcome-based documentation is legally and clinically appropriate. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.